Good morning. Today's topic and tip for today is all about your fascia. Have you heard about fascia? You can think of fascia as connective tissue. So it's like saran wrap around every single muscle fiber, every single bone, every single organ. And you can think of it sort of as all these spider webs interconnected in your body. And you imagine if you were to yank here with some tension from a big fall or a car accident or a big hit or a big emotional strain or a postural strain. So if you're going to have some chronic tension somewhere, creating tension in that fascia, it will affect every other spider web. That's what happens with fascia. So it's really neat because you can, for example, the lateral fascia chain. So lateral is the side. So this bone, your temporal bone, your hip bone on the side, your hip bone, and then a bone on the side of your foot, your cuboid. Those three bones, along with some other structures, are the lateral fascial chain. So sometimes, I've even heard of a story, it was one of my colleagues, a patient was experiencing vertigo. He treated the foot in the cuboid because of that lateral fascial chain, and her vertigo went away, which, was being yanked. That was the cause of it. Does that happen with everyone? No, of course not. Everybody's different and the cause is different, but that was a cool one. That was kind of fun. So that's what's really neat when you start to learn all the interconnectedness of the body is, that's why as an osteopathic managing practitioner, posture is so important, and looking at the whole body is so important. I care about the symptom, but I really care about where the tension is, where the most tension is in your body, because that's probably, releasing that will help other symptoms. I was an RMT forever, a registered massage therapist, which was wonderful. I love massage. And I chased pain. People had a sore hip or a sore back, and that's what I treated. And I got results sometimes, and sometimes I didn't. So it's really fun now to have this huge toolbox, knowing about the fascia and how it's like spider webs everywhere, and knowing that, the right shoulder, left hip are connected fascially, the right hip, the left shoulder, so that cross chain there. So again, when someone has a chronic shoulder issue, I also know it's related to some parts of the small intestine, just because of the flow of the fascia. So many things. And then the one that I really love, you can also expand the fascia and think about the connectedness of your nerves. So your nerve, C3, C4, C5 are right here, your vertebrae and your neck. And what comes out of that? The nerve that goes into the diaphragm. So if you have chronic tension in the diaphragm, you can be yanking on the neck through that nerve. Isn't that crazy? So cool. So you can get all the neck treatment you want, but if that's not the cause, it's the cause is your diaphragm, it's going to work so much better if you can treat the diaphragm and do your deep breathing. So super fun, I think, this stuff is, because learning the interconnectedness of the body sort of is like, oh, now I get it. So fascia is a big deal. Drinking lots of water is great for it. And of course, breathing's great for it to get the fluids moving, and stretching, and lots of practitioners work on fascia, which is great. And all the tips and tricks for posture are super important for having healthy, awesome spiderweb fascia. Hope that was helpful. Have a great Friday. Bye.